I'll bring Jim White up, and he'll let you guys know where we're at.
Hi, everyone. I'm going to introduce you. It's best to have the physician that treated Rich immediately upon the event occurring to give you guys a little medical background on what occurred and where we are. I'd like to introduce Dr. Gil Salazar from UT Southwestern Emergency Medicine.
Hello, good evening. I form part of a team of several providers who take care of Rich. What I know so far is he slumped on the bench. He was brought back to the hallway for treatment where we treated him for a cardiac event, successfully treated with standard therapy. As soon as we treated him, he regained consciousness. He was alert and awake talking to us after the event and quickly transported to the hospital. At this point, I was able to talk to him in the back of the ambulance, and he was able to tell me where he was, and he actually wanted to get back in the game.
In layman's terms, what was the cardiac event, and was there a pre-existing condition?
Should I discuss pre-existing?
Yeah, sure.
He does have a pre-existing condition, and the condition that he has is a normal quivering of the heart that does not allow him to send blood to places where he needs to in his brain and heart.
Was he feeling funny on Monday at all, and was he cleared to play today? Or on
As far
Sunday,
as-
rather?
I'm not aware of him feeling funny here recently.
What hospital was he taken to?
St. Paul.
St. Paul Hospital. It's UT Southwestern, St. Paul.
You talk about standard treatment. What does one do once he has this event? What goes into getting everything going?
We provide oxygen for him. We started an IV. We did chest compressions on him and defibrillated him, provided some electricity to bring a rhythm back to his heart, and that was successful with one attempt, which is very reassuring.
Do you have any official timeline of when, how long he needs to recover?
At this point, I don't have a clear timeline. He's going to go to the hospital. I assume he's going to have extensive testing over the next day or so, and I assume more information will be available later on. Well, cardiac events to suffer for a young person, this is the one that we are understanding really well. And it's very fortunate that there was a team that is well trained on how to manage these, because if you treat the patient adequately, there's very good recovery parameters for these patients.
What does it do to his long-term future? I mean, because he's had this issue before in terms of irregular situations.
Once there's a cardiac event like this, it becomes a matter of trying to find a cause and addressing it. What this does to the future it's hard to say. There are many causes for this, and the doctors at UT Southwestern will do extensive testing to rule out the major causes of it and address them appropriately.
How closely has the team monitored it, knowing that he's got this pre-existing condition?
Extremely close, including consultations with other hospitals throughout the nation.
Is there someone from your team here on a routine basis for each game?
Yes.
Member of UT Southwestern from several fields are always present at every game, and Dallas Fire and Rescue paramedics are always on standby as well, and everybody works together for these types of events.
Is this something the team's aware of, and is that how he was able to get care so quickly that they recognize signs and symptoms, or how was that seen?
Yeah, so we have a specialized team that's implemented that trains preseason with the training staff, who did a fantastic job today. And that team is made up of internal medicine doctors, orthopedic surgeons, trauma surgeons, trauma doctors, airway specialists. They're all here to respond to incidents like this, along with the Dallas Fire and Rescue paramedic staff. We train for episodes like this with the hopes that they never arise, but our ability to act today quickly for Rich is a testament to the training staff and the team approach to how we prepare for these events.
Dr. Robertson, you want to give them your name too?
Sure. Dr. Bill Robertson, head team physician at Dallas Stars.
Dr. Robertson, did you have anything to do with Rich's treatment in the summer or before the season started?
Yes, and we have been monitoring him closely with regards to the treatment that he was receiving for a different type of arrhythmia, heart pattern that he had.
Good, guys. We'll turn it back over to Jim Lights.
Thank you, guys. Appreciate it. This is obviously a very traumatic thing for all of us. None more so than the players and Lindy, Ruff, and our coaching staff. Our best wishes and prayers go out to Rich and his family. It's a pretty tough event, and you can kind of, and it's really a tribute to the National Hockey League and our great friends John Davidson and the Columbus Blue Jackets that very quickly. It's a traumatic thing. Players don't want to play, and I don't blame them. We will, as I understand it, the game is suspended. The league sets the rules and of the how and the wherefores. I don't know exactly what they do, but this game will be replayed. And I can't guess, you guys, if they're going to do it. I don't want to say something I don't know for sure. Whether they replay it from this point or replay it in its entirety, I have no clue. That decision will get made by Commissioner Bettman and his people, and we'll abide by whatever rules and whatever they do. It's obviously a compressed schedule, will be difficult to do, but we'll all work together to do the right thing. And right now, all that matters is the care and well-being of Rich Peverley and his family, and our players and the Columbus Blue Jacket players. I want to thank John Davidson and his people for being as understanding as they've been, and they are. And once we know anything about tickets and when the game's going to be replayed, we'll certainly communicate that to everyone. Anything else?
Coach Ruff?
Yeah, Lindy?
When you had the incident last week, was there any concern, or you just figured that it was okay? And he played 2 games since then.
There wasn't any concern. Like they said, our doctors have done a fabulous job monitoring the situation. We've done all we possibly can to make sure that we were taking the best care of Rich first. And, personally, I thought the medical staff did an unbelievable job today. I mean, I was there firsthand. If it wasn't for our doctors and all the members reacting so quickly and so efficiently, I could be standing here with a different story, but they did an absolutely fabulous job.
How did you know something was wrong?
As soon as he came off the ice, he collapsed. I instantly stood on the bench and started screaming up in the crowd for a doctor. And actually, there was I think one lady put her hand up. I think she had a Stars jersey on, said she was a doctor. I was just screaming to let the doctors know we needed somebody ASAP. And they were there ASAP, and I can tell you firsthand, it was an absolute marvel what they went through.
How do you travel and play and do all that kind of stuff with the players?
Well, you can't ask I had a discussion with the players first. I addressed just saying a prayer for Rich and thanking God that he was okay, and told him that the first thing he asked me was how much time left in the first period. I mean, that's a typical athlete, but there's not one guy in that room who wants to play hockey right now. And I'm not there to persuade them to play. I don't want to coach a team right now.
Well, in the game, you have to put them on, apparently.
We got to get by this moment, but that's the furthest thing from my mind right now. We'll stay with Rich for this period of time, and he's going to be okay. Everybody feels that the care has been given, and the care in the future will be the most important thing that he can possibly go through.
Has his family and next of kin been notified?
I'm going to say yes.
His wife was.
Yeah, his wife was
in the
there, so
ambulance.
his wife was in the ambulance.
Can you describe the seriousness? I mean, obviously you're shaking. You see injuries all the time, cuts, things like that. I mean, this is just such a different level. Can you describe, what you were feeling as it was taking place?
I was scared. I was just, my first emotion was we need somebody here real quick. When he dropped, it was red alert. Don't worry about the game. Don't worry about anything else. Just turn around and scream for a doctor. And that's all. It was just, let's get him to get him the help he needs, and they came and got him the help. For me, it was something I don't want to witness again. I know we play a game that there's a lot of emotion and a lot of passion, but the first thing I thought of Rich and his family and his kids, and what a good person he is, and just prayed for everything to be okay.
How are your players doing? Obviously, it's pretty traumatic.
I think that they're doing like everybody in this building. They're the guys that live with them, that you got that camaraderie in the dressing room. That there's nobody in there that wants to play hockey right now. And I think everybody understands that. And when you witness what they had to witness, and that's their teammate. And that's the right place to be. That's the right emotion to have. And they're not doing very good. And I wouldn't expect them to be.
So you did talk to him and he was revived?
Yeah, I was there with him, and I just wanted to say a couple words to him, and that's what his response was.
Good guys.
Thanks.
Thanks.
Thank you.